Hello and welcome, dear friends. Good evening. I, Dr. Jayanti Bhate, practicing anesthesiologist from Thane, along with my friend Dr. Alpa Dalal, practicing pulmonologist attached to Jupiter Hospital, Thane, are conducting today's session of UMANG. Today is the 23rd session of UMANG, which we all know is an initiative by the doctors for the doctors. It is a platform where we discuss how we can overall grow together, keeping in mind different age groups and different specialities. It is a space for rejuvenation and being happy. So today, what are we going to discuss? For many of us, the larger the problem, the more we resist and contract and react unconsciously. There is a German spiritual teacher named Eckhart Tolle who has said that given for the moment, we have always a choice to remain open to life, alive with what it is, and experience the natural sense of peace and aliveness that he calls as the joy of being. So today we are going to see what this joy of being means to the different the panelists we have got here to make us realize what this joy of being actually is. Alpa?
Thank you so much, Jayanti. First of all, Team UMANG. From Team UMANG, let me thank all the panelists and Dr. Jayanti for being part of this session. So why we decided to choose this topic, the joy of being. See, most of us take up this profession, medical profession, to fulfill our dreams and to be happy. But none of us are actually prepared as we go along in life and face all the challenges. And the biggest challenge is how do we balance all the aspects of life? And somewhere down the line, because of our educational conditioning and what we learn from the seniors, it's just that we get caught up in the compulsion of doing so many responsibility, being responsible for your success, making money, making your name, reputation, and giving time to your family. Now, in all this responsibility, somewhere the self gets lost. Okay, so the joy of being gets replaced by compulsion of doing or the duty. But there are few amongst us who have been beautifully able to manage the work-life balance. They're able to keep the passions in their heart alive. And today we have such speakers with us who are going to share their journey, their wisdom, and their insight. And I'm sure many of us who have not been able to do that or been able to do to some extent would like to learn from this very, very interactive session. So first speaker is Dr. Ingalharikar sir, Dr. Vinod Ingalharikar sir. And I'm sure he needs no introduction. He's been there in practice for more than 5 decades, a well-known spine surgeon. He's been a professor and a teacher. He's written so many books, a poet, a painter, a sculptor, and whatnot. And what I like about him and what he inspires is that even after 5 decades of practice and he's still getting younger by the day, he lives his life with full intensity in whatever he does. And that's really a source of inspiration. And when we see him moving around in the hospital with so much of zest in life, just looking at him going about his day-to-day routine, that itself is so inspiring. Today, he's going to share with us his journey, how he's been able to keep passion in his heart alive. And over to Jayanti for introducing our other 2 speakers, Dr. Harshad Purandare and Dr. Avinash D'Souza.
So, Dr. Harshad Purandare, he represents the younger generation of the surgeons and the practicing physicians. He's been in practice, he's done his MS General Surgery from GS Medical and MCH Neurosurgery from Sri Chitra Institute, Kerala. He's been in neurosurgery practice for the last 16 years, and he's present working as a consultant neurosurgeon and chief of the neurosurgical services, Jupiter Hospital, Thane, for the last 12 years. He's operated more than 2,000 cases, and he runs a really hectic surgical side. But in spite of that, he has managed to achieve the work balance, and we would like to hear from him later how he is managing his life earlier now. That's 5 decades compared to Harshad. So that's him.
Would you introduce Dr. Avinash?
Yeah, Avinash also. So Avinash is like the overall spiritual master of today's thing, who is going to opine and give his third person opinion on the whole thing. He's a consultant psychiatrist and he runs this D'Souza psychiatric care center. And he specializes in adult and child psychiatry and also in corporate trainings. He goes ahead. So he's a very busy psychiatrist and he gets consulted for counseling. So he would like to give his expert opinion on today's session and how to manage the whole work-life balance. So we can start with the question answers.
Yeah. So my first question is for Dr. Ingarkar sir. So you are into practice for more than 5 decades now, and you have seen it all. I would say you managed your own clinic, your own setup, and you were into team building, and you you were a teacher, professor. You developed so many hobbies, and then you the transition into the corporate practice. And while doing all this thing, you kept your passions alive. You are enjoying your life to the fullest. And we would like to know, sir, from your journey, how could you manage it all, and how could you be good at doing everything together?
So you'll have to unmute, I think.
Sir, you'll have to unmute yourself.
Oh, can you hear me now?
Yes, sir. Yes.
Okay. Right at the outset, I would like to thank UMANG team for inviting me to speak here. I would like to begin my talk quoting 2 lines of one of my poem ghazals. This is what most of us are, and I think that needs to be altered or changed. In Marathi, we said, कर्तव्याच्या घरास माझ्या केवळ खिडक्या उंच गजांच्या. कर्तव्याच्या घरास माझ्या केवळ खिडक्या उंच गजांच्या. दार बनविण्या विसरून गेलो, जगत राहिलो आड गजांच्या. दार बनविण्या विसरून गेलो, जगत राहिलो आड गजांच्या. Loosely translated in English, it will mean, my temple of duty has tall windows with the bars. My temple of duty has tall windows with the bars. Oh, I forgot to create a door. For decades, I'm behind the bar. Well, this is what all of us are. All of us happen to be there. Few of us don't get into this, but most of us otherwise are in this particular situation to begin with. I would like to take you back to 1971, 74, and those days of my life. I did lead a very hectic life. It was a very stressful life. Didn't I know that doctor's life is stressful? Of course, I knew about it. In fact, I thought stress is a collector's item, and I kept on collecting a lot of stress. I was honorary professor at Orthopedic Science Medical College from 1971 to 2000. That is 29 long years. I used to commute from Thane to Sion 5 days a week. In the beginning, it was a two-wheeler, then it was a train, then it was a car, whatever it is. But it was a stressful journey 5 times. All my mornings were spent there. So my mornings were not available for developing practice here. I realized that I do not have proper facilities, surgical facilities, or sterility aspects of the areas in different nursing homes that I was using. Therefore, in 1980, I started my own nursing home. I was also very much into academics. And in 1982, I hosted a conference called Western India Regional Conference in Thane. Though there was a team, I single-handedly did everything. And immediately following that particular conference, I had my cardiac episode, first episode, where it was cardiac irregularities, tachycardia, which stayed at 110, 115 for almost 6, 7, 8 days. I was hospitalized for observation, etc. I anyhow came out of that. There's a body called Association of Spine Surgeons of India. It's a large body, today known as one of the 6 top spine surgery bodies of the world. It's called, and it was my brainchild. I was the founder secretary, and I nurtured it from 1985 to 2003. Non-stop, I was looking after that. It was a great stress. I used to travel a lot. Almost twice a month I would travel, go and take workshops somewhere, etc. I was invited overseas as visiting lecturer and professor, so many places. Then 1986 to 88, I went through a domestic difficulty. My elder daughter, who was 17 at that time, developed what we call idiopathic renal sclerosis. And there's no treatment for it. There was no treatment then also. And after some time, after trying various things, I even took her abroad for consultation. And then eventually we got the transplant done. We lost her following transplant within about a week or 10 days. So all this put together, I had a very tremendous stressful life in that. 1988-89, following my daughter's demise, she was not only my daughter, she was my good friend. We had extremely friendly relationship. I was very highly irritable. I was irritating. I slept poorly. My blood sugar was fluctuating.
Sir, unmute yourself.
Can you hear me now?
Yeah, yes.
Okay. So I even often avoided the phone calls. The journals were piled up unused. I missed social occasions. I had a tremendous academic satisfaction. I was well known by that time. I had a good practice, I had a good name, good reputation, but still somehow I was not happy with my job. I still want to do something more, and I kept on collecting stress. I kept on doing lectures, so many responsibilities. What happened so often is at 4 o'clock, I'll finish a surgery, go home, have my lunch, and would just lie down. And at 5 o'clock, I'll ring up my clinic saying that I'm sorry, I'm not attending today. And I will just lie down looking upwards to the sky. This absenteeism happened more than 2, 3, 4 times, and it really shook me up because I was completely consumed by a role as an orthopedic passionate teacher, Association of Spine Surgeons of his mother and father. And this is a very shocking particular time. I want to say very emphatically something here. Your family members also participate in stress. If you don't remember that, your stress profile will always tremendously increase. I was missing my childhood and younger friends. I was missing my music, my singing, my violin playing, my stage performances. I was missing my dramatics on stage. I missed my poetry, my literary meets, my drawing, painting, my volleyball, trekking, my photography. I was active in all this from my childhood. And I missed all of that. And I realized I was heading towards a crisis. I've been taught by my parents to look at myself as a third person and analyze myself. And as I kept on progressing in the life, I kept on analyzing myself. What did I go through? Why did this happen? So I realized there is a compulsion to prove that I'm a good orthopedic surgeon, I'm a good teacher, I'm a good father, I'm a good mother. To do all that, I work very hard. I work harder and harder, often neglecting my own needs. My food timings were irregular. My sleeps were irregular. There were times when for Nights together, I have not slept more than 3 or 4 hours doing something or other. I realized that I had internal conflicts with myself. I had external conflicts with others. I was also denying that I am developing these problems. I went through withdrawal. I had behavioral changes like irritability. I started becoming depersonalized, something which I've never ever imagined that I would become, because I was so amicable, I was so popular, I was liked by people so much. I developed emptiness and I did sort of started going in depression. Well, I realized that this was a burnout syndrome. We have all heard this term, but we don't know what it is in clear terms. So burnout is work-related stress syndrome resulting from chronic exposure to job stress, both in a low-grade chronic manner or acute, subacute exacerbations of that. Well, all of us know that stress is an inevitable thing, and it's even important part of a medico's life, because that's what makes you work, that what makes you perform better. And in medico's life as it is today, the stress starts at the age of 15 years when they go from 9th year to 10th standard. And then it continues till the lifetime. The 12th standard, the medical admission, the PG admission, the NEET, the PG residentship, and so on, it goes on. The stress is sometimes minor and sometimes is extremely devastating. This phenomena has come to light now. When I was doing this study for myself, I realized that 1970, there are no papers on this, no publications. 1980, 27, 2311, and 2019, there are 2145 papers published on these aspects of medicos stress and medicos burnout. So you can imagine the magnitude of the whole thing and the awareness which people have. Today's definition of success is something which is created by society. Those ideals, those stereotypes, they're created by society itself. And largely, very broadly speaking, somebody who has a large practice volume is a successful people. Now the medical day is also 24 hours. You can never say that I will not work after this period. Everything put together, I think we all get into difficulty. I always kept on asking myself, was I successful? Am I successful? Because the traditional success model of large practice, large volume practice, large earning somehow did not make me really happy. It never lured me in a true sense. In fact, I was very happy doing small day-to-day tasks, both in orthopedics and extracurricular, successfully, excellently. They made me feel good about myself. I, over a period of time, learned that I must have more meaningful or wider meaning to my life. I improved my staying organized. All this requires being well organized, which includes also, I sharpened my time management skills also. Around the age of 55, my desire for career growth plateaued out. I didn't bother about growth, neither financially, neither practice-wise, nothing. It just was there. Again, I asked myself, was this a new burnout of another kind? No, because I continued medicine as passionately as before. I continued what I loved to do and I enjoyed most. The first thing was connecting with the patient. I love my patients. I still enjoy being with them. Doing surgery, and more important still, teaching students and connecting with youngsters, because that is what keeps me young and all through. Now, after this particular turning point, the other hobbies which I pursued earlier, they have started intellectually challenging me now. I learn every few months, I learn some new hobby, and I'm like an enthused novice. I go to them, I work hard on them, I feel. I found many people who were standing tall above the crowd. They're all people, they're passionate about what they were doing. And if you look at their eyes, there's a kind of a glint. The whole thing is seen in their eyes. They get up every morning and get out of the house, not so much to make the money, but do something much, much more than that, which will satisfy them. I have seen lots of successful people, success not only in terms of money, but in so many fields, and they do what unsuccessful are unwilling to do. Most of us are either dabblers, we get tired, we get bored, so on and so forth. These people just continue. For anything, you must begin as a dabbler, any new hobby or whatever it is. We'll discuss it further. And do it with consistency, and someday you will become master. Most important thing, you will be a happy and good doctor, and you'll be happy family person. People always worry about starting, how to start, when to start, etc. Well, again, I'm going to probably I get chance to say that. But most important thing is you must discover something which can focus energy. You know, Martin, what is my definition of a de-stressor? If you forget that you have a serious patient in ICU, if you forget that for those 15-20 minutes, half an hour of pursuing something, that is a stress buster. And you must do something. If I'm stressed for the whole year, and if I say that for 15 days at the year end, I'll go to Switzerland for de-stressing. No, it doesn't work. If you get stressed every day, you need daily or as frequent dose of a de-stressor in whatever manner, and don't wait for it. Don't wait for this. You can't say that my son is doing final MBBS, he will become MS orthopedics, then he will join, take over my practice. After that, I will develop some hobby. No, don't wait till you get Parkinsonism. Don't wait till you get carpal You cannot pursue your hobbies later on. My take is this: if you see your work email on weekends, which I'm sure most of us do, why can't you see a movie on a weekdays? Why can't you sneak out some time and do that? So friends, stress is there. Stress is going to be with us. Our life probably is going to be more stressful, but a time has come for all of us to be aware of these burnouts, aware of the stress, and must act on it. I'm sure the next two speakers are going to shed a lot of more lights, a lot of ways of doing. And if I get chance, I might add a few things to it. Once again, I thank you all very much.
That's a wonderful sharing, sir, and so insightful. And the way you've been able to manage this, and some of the key thing that I learned is that you should be able to objectively look at yourself, where you are going.
Yes, that is very important. And
that
I
is
think
very important. Most of us don't realize when we are getting dragged, we don't realize. And another thing is that you need a daily dose, like how you have your daily cup of tea, your daily bath, your daily things that you do. You need a daily dose of happiness, joy of being. Wonderfully said, sir.
Thank you.
Yeah.
So the next question I would like to direct to Harshad. Harshad, now that sir has said that problem has been identified, that there is a burnout among the doctors, they are facing this situation. So why wait? So why wait and face that situation? So what have you done to identify? Because you belong to a neurosurgical specialty where your erratic working hours and so much stressful post-surgical patients, pre-surgical tension. So how have you managed to balance the whole situation?
Thank you. Thanks a lot, everybody. I think I'm too young to preach, and I perhaps represent a lot of people who have a similar thought process approach. I mean, I have a set of friends who are hikers, who are possibly music players, who are doctors. And I think I possibly represent a generic thought process which is there in a lot of us. I don't think that all doctors do this sort of working approach. Yeah, you are right. I mean, most of my surgeries, I work in skull base, I work in neuroendoscopy, vascular, brainstem, and my average surgical times are about 6 to 8 hours. Most of them run to 10 to 12 hours plus emergencies. Yesterday, I had 5 visits to the hospital, including a carotid rupture, which I had to go in for. But yeah, I enjoyed, as sir said, but it doesn't mean this is my spinal cord. This is not my core. No, I'm from a convent. So convent school has, Antonio da Silva has 2 gods. One is Jesus, another is football. Yeah. And so, I mean, from kicking around balls to training for cricket and swimming was something which I did in my childhood. And then 10th to MBBS, everything was sort of stolen out. And never wanted to leave it. So once I got back into my practice, new passions, gardening, reading obviously was carried on, cycling, squash, and travel. A waiting bucket list is obviously learning jazz music, which I hope I can do, but that requires me to go to a teacher on time. And that is something that I can't promise him or her right now. What I did one place practice. I think I cannot run around from 10 places and be in Thane and get a call for a pupil dilated at Kalyan. It makes no sense for even the patient's respect. I needed a complex work infrastructure where I have responsibility shared by faculties, and that's why an institutional practice for me from the first day itself. There would be somebody who will take care of the critical care part of it, and that's the infrastructure I work with. I do all my majors in the morning. I prefer not to start a major at beyond as a follow-up case at 12 o'clock. Starting a case getting over at 10 is absolutely not my cup of tea unless it's really forced upon me. If I'm doing 2 cases a day, I would not club 2 majors. I would never club 2 majors. The integrity, the mental thought process is not ready at the end of second stage. In neurosurgery, when you start a surgery at 8 o'clock, you're actually on the tumor at 11:30, 12. So 3-4 hours have already gone in that period of time. And if you're starting at 3 o'clock, you're on the tumor at 7, and it makes no sense. You are halfway rushed. I did that once, and I have had a patient who was bad. I would club a minor maybe. I don't keep an OPD on the day when I'm doing a major surgery. I'm very clear about it. My patients don't have to wait. I have to take rounds post-surgery. I'm hungry post-surgery and mentally drained post a complex brainstem where I possibly fiddle around the vertebral artery. And I don't want that half thought process to go to my patient care. I have categorically stopped doing OPDs unless I'm getting free like at 11:30. If it's 4 o'clock, I don't do an OPD on that day. I prefer not to do an evening OPD after 6 as much as possible, to the dislike of a lot of people. In India, we all come 1 hour late. So the 6:45 patient will come at 7:45. And you are forced to see him, and then your day goes away. I nowadays often take a mid-week evening OPD break, which I would prefer, which I avoid, and I can take a time, and I would prefer to be back at 6:30 in the evening. If it's possible every day, I do manage it at least 3 days a week. Have a cup of coffee with my family. That's always better. Even after that, if there's an emergency, my casualty arrival to OT time is 35 to 40 minutes. So when there is a need for it, it's there. But then when it's not required, I think that's how it goes up for me. I am into building a team now so that my work responsibility is shared, and I do attend conferences, but I think a lot of meetings, conferences, seminars are purely marketing ventures where they destroy your weekend. You really don't need learn anything great in most of the week. I choose 2 or 3 absolutely good conferences, and that's what I prefer to attend. Predominantly a specialty-based conference like a skull-based surgery or a vascular surgery conference. That's what I prefer to.
I think very valid points, pearls of wisdom you have shared. And it's a good time management skill. I think somehow people need to adapt themselves to this. And I think thanks for sharing this, Harshit.
So having this clarity and courage to draw the line, that's very important. And I think most of us are not able to have that clarity and courage.
I think 2 valid points was settling your practice at one specific, the travel time, avoiding that, the stress of traveling and commitment to time helping there. And the second is the whole team effort that he specified. I think that also makes a lot of sense, Harshad. Yeah.
Thank you.
So my next question is to Dr. Avinash. Dr. D'Souza, you've been into psychiatry practice, and What's your opinion about this issue of work-life imbalance in doctors' lives? And do you think it is more common in our profession compared to other professions? And do the doctors actually realize that they are burning out, and do they seek psychiatric help when needed? So please share your journey as well as your insight on this issue.
Yes. Thank you so much for having me here. I will share a few points which I think are relevant first, and then I'll also share about doctors in general. In a psychiatric practice, it's a very different kind of a practice versus maybe a medicine or a surgical practice, which of course is far more intense. A psychiatric practice is intense, but in a different way. Now, in psychiatry, we can't really have teams because most of the patients who are coming, they want to see you personally because they come to share their deepest, darkest emotional secrets with you. So they would not want to talk to an assistant who would brief you. Unlike maybe a medical problem or a surgical problem, which is more acceptable. There's a lot of stigma around psychiatry. I think for me, one advantage is I agree totally with Dr. Harshad that practicing in one place helps in a big way. And I mean, I'm available on different days of the week at different slots. So I tell people I'm there some days in the afternoon, some days in the evening, some days in the morning. So you can suit your time to come. So that's one major advantage. The other thing is, yes, I take a week, midweek off, which is very important, particularly in psychiatry, because you're listening to so many people say so many things, and you need to have that time out to freshen yourself. You need to have a group of friends beyond doctors. Not that doctors are not good friends, they're very good friends. And I mean, we need doctors because, you know, we gel well, we talk well, we, you know, share a lot of medical stuff, but you also need to get into a world beyond medicine where, you know, you learn about a lot of things that are happening on a day-to-day basis. So meeting your school friends who are probably non-medicos, meeting other friends who are non-medicos, going out for lunches, dinners, meetings, parties with them is very important. Planning outings is important. Whenever, I mean, I'm also partly a teacher because I work currently at Sion also as a visiting consultant. So my mornings are there. I practice solely in the evening from 4:30 to 9, and I'm very particular about my timings. A lot of people tell me that you could, you know, earn a lot more if you had a morning practice also. And I remember one of our of course, VTI sir would know, we had Dr. P.N. Kelkar, our honorary at Sion, and he told me, who's a better barber? One that shaves 300 at Tirupati or one that shaves 5 in Taj Mahal? So I said, Tirupati. So I think that is the reason I think I joined Sion, because it gives you that added clinical skill, that clinical edge. It also makes you see a variety of cases you don't see in a private setting, you know, which is also very, very important, and you are up to date with the latest. Otherwise, we tend to not read and not be aware sometimes about many things. Yes, spending time with people who are younger to you, teaching students, they keep you on your toes. So it's very important that, you know, and you feel young, you feel zealous enough to be with them, which is important. I teach psychology also. So I teach psychologists who are in MA courses. So I visit colleges. So that's a big break from medicine. And the main thing is I've started what I call D'Souza Foundation, which is an NGO that works in the area of mental health awareness across all sectors. So we conduct programs for everybody, right from corporates to auto drivers. So we've done something for auto drivers on mental health. We've done something standing at Bandra station, railway station, talking about mental health. We've done something for senior citizens in Rotary, talking about mental health. And my whole thing is that maybe it's possible in psychiatry. Is that and I think in other specialties also, that we're focused on the preventive angle a lot. So you speak a lot to normal people. You don't only speak to patients the whole time. So it, you know, broadens your view about people and it makes you feel better. So that is one perspective. With regard to the whole burnout thing, yes, I think if you ask me, there are some doctors who are very aware and very well they know we need help, but the reluctance to seek help is there. There are others who know they need help, but they deny that they have a problem. So there is many a times I know when I have probably gone to Reliance, I've just seen a patient, Even my Reliance days, I don't go more than once or twice a week. So when I go there, if I see a particular colleague and I tell them, I think you are looking a little anxious. I think you're a little worried. They always wonder, probably I'm judging people by looking at them. That's my characteristic. So, and then, he'll say, no, I would like to talk to you, but not now. I'm in a hurry. And I say, if you miss this chance, you'll probably, miss it. So then he'll immediately say, can we go and have a cup of coffee? And he'll sit down and he'll tell me some personal problem of his. And sometimes just that talking for maybe 15-20 minutes helps him, emote and makes him feel better. He may not need medication, he may not need treatment, but he might just need someone to hear him out. Like I remember a very famous cancer surgeon who came to me and told me that, why do we see in medicine? Doctor, I'm a little disappointed and I'm unhappy. I mean, I'm doing my best till I see that. So I told him that it's not that, you're causing the death. It's not, you're in a field. I said, in any field that can happen. I said, in psychiatry, we see suicides happen. I said, it's not that. And I said, if one of my patients succumbs to a suicide, it doesn't mean I'm a bad psychiatrist. I said, we've done our best, but these things can happen. Yes, we do have our bad days where we feel upset, we feel sad. And I think doctors have to also realize and admit that we're human. We're not super. Many times, we put ourselves on that pedestal that, we are supposed to care for everyone and not for ourselves, that is the pedestal with which we're brought up. And it's important for us to realize, I also want to be loved, cuddled, taken care of. I also want to be pampered. It doesn't mean that, I sit with a grumpy face and say, I can manage everything. No, not at all. And you need to spend a lot of time with your family, with your kids. I've had a lot of doctors who come to me when their children are in the teenage years. And they tell me, sir, मैं अपना career बढ़ाते गया, but उनका बचपन नहीं देख पाया. And I feel very bad for them at times. Because the formative years of your kids are also the formative years of your career growth, at that time. And it's very important that you spend time with your children when they're small, because you suddenly then want them to adapt. I'll just take 1 minute more. And, another form of burnout, which I have seen. I've seen a lot of doctors who come to me who, don't face burnout otherwise, but they are upset and sad. And this is a facet I want to bring out when their children don't want to do medicine. So they'll tell me, can you counsel him to do medicine? And I say, that's not my job. Let him do whatever he likes. And I always say, my son has, I have enough of savings for my son to do whatever he likes, but not to do nothing. So I said at the same time, I can't expect him to do psychiatry just because my parents were psychiatrists. Both my parents were psychiatrists. So that's why, I became a psychiatrist. It was not that I was forced into it. It was out of love that I took it up. But the thing is, it doesn't mean my son will become psychiatrist. So I said, you can't, push children to do that. So I had a doctor who came and told me this is the very words he used. He said, this infrastructure which I have made, who's going to manage after I go? So I told him, sell it off. I said, no one you've not made it for your children, So he said, I have so many patho labs, who's going to run it? I said, sell it off, give it another franchisee. There's so many things you can do. You enjoy life, let your son enjoy life. I said, saying, no, he wants to do MBA. MBA mein kya rakha hai? I said, he wants to do his own career path, let him find it. This is something which, many of us have it, that it has to go on from generation to generation, that, that doctor to doctor legacy has to continue, which I think is also, and then burnout sets in, that, what do I work for? What is the use of me working now? There's no one to take over from me, but you have to work because you have to work for yourself. You don't work, for your children. You work for yourself, for your name, for your satisfaction. So that is something which is important. And last but not the least, I think people have to also realize that normal people go to psychiatrist. They always feel that if I go to a psychiatrist means I have a disorder. No, a lot of normal people go to psychiatrists just to seek help. We don't diagnose everyone. We don't medicate everyone. We're not such bad people. So, so you can visit us and just say hi, hello, and, discuss your problems with us. Thank you.
That was wonderful sharing. And I think it's very important for all of us to realize that our happiness is equally important. I think we just focus on making other people happy, but we don't focus on making ourselves happy. And that's, I think, part of our cultural conditioning. And this is what we learn from our seniors, because we've seen our seniors log it out, and trying to take care of everyone but for ourselves. And I think that's one thing we need to learn, that please start looking after yourself, listening to your bodies and listening to your hearts. Very well said, Dr. D'Souza.
Yeah, thank you. Thank you, sir, Avinash. And one more thing now I would like to ask, sir, because this is the developing hobbies and skills. So without feeling guilty, I like to travel. Now, if I have to travel, sir, 1 minute, so if I have to travel, then there is that maybe now for me it's easier, but then somebody who is practicing early days of practice, and you say develop a hobby, you have to take time out for that. So without getting that, how do you manage that? How should one manage? And what age should they actually start? Not wait for a burnout or not wait for getting really engrossed in practice. So what age should they ideally begin to start cultivating a hobby so that it just backs up your stress when you are actually in the middle of roaring practice or something like that?
Sir, unmute yourself.
Okay. Jayanti, you asked me the question?
Yes, sir.
Okay, all right. Okay. Now, according to me, we must have life beyond medicine. And we must have it right from the day we entered medicine. If we don't have that, you are building up a cozy nest for a stress to grow, multiply. Traveling is something which everybody must do. If you can't afford, do it. Some people are just not made for it. It doesn't matter if you don't like traveling, do something else. As I said, any hobby or anything beyond medicine, I'm not saying medicine. Again, you get into another branch of medicine, I will read this, there's no point. Go beyond the medicine. Go beyond the thought of a patient. It can be reading, it can be playing bridge, it can be walking, it can be running, it can be like Harshad does cycling. He does a huge amount of cycling every day. So it can be anything, it can be music, it can be poetry, anything. Still, one important thing which I have always felt, that all this must be started soon. Don't wait for a long time. Do it as soon as you can. Don't wait. You will lose your flavor of your children's young age. You will lose your children. You'll only get grown-up boys and girls around you, which are difficult to manage after that. So do it right from beginning. What you do, it doesn't matter. Do it right from beginning. Now, another thing is anything that gives you happiness must be pursued at least for some time. You can have multiple hobbies. You can do things. But do that right from beginning. Don't wait for any time. One important thing, another thing is any hobby which involves physical activity, say cycling, trekking, walking, or like I do carpentry or such things, which involve physical utility or use of a body mechanisms, are better. Rather than listening to music, do music. Even doesn't matter how you sing, doesn't matter how badly you play keyboard, but do that. All those actively participated things will really do good for you. If it is okay, can I show you what hobby, where you can reach beginning from zero? Alpa, can I show you something?
Yes.
It starts like an ordinary board. Starts like an ordinary board and then eventually turns into this.
Wow.
So you'll have to hold it a little closer.
One sec.
Can you hold it little?
Yes, just one sec.
A lot of glare.
Now, what I have done is I have blurred the background, which I'll remove.
Oh, beautiful.
Oh, beautiful.
This is how it starts. And you turn this into it. Not only it takes my physical effort, I sweat on it, I have my maintenance of physicality, but the creation gives me immense happiness. It can be something like this.
Beautiful.
It could be this. Or it could be as small as it's made out of log wood. I have lots of hobbies which I have developed in childhood, but I positively nurtured them when I realized that they are my saviors. They are my saviors. They give me immense satisfaction. And when I pursue them, I think I practice medicine better. I am a better medical person when I'm doing all this.
So true. Harshad, about your cycling, you would like to say how much time you managed to find and how good that made you feel.
Yes, and Harshad, the one more question to you is that the sir is in 5 decades, more than 5 decades of practice, and you just finished maybe 1/3, 15 years of practice. When we try to tell this to youngsters, they find it very difficult because when they start their practice, there is so much compulsion to do well, to establish themselves, to build a reputation for themselves. So they find this extremely difficult. And when it comes from seniors, they feel that, oh, you have just achieved it all. So it's easy for you to say, but be coming from a youngster like you, they would take it more seriously. So what's your take on this? That how soon should this work-life balance start, and how do you, in the initial years, save yourself from the compulsion of doing and establishing yourself?
I think it starts from day one. Perhaps the first day when I said I don't want to do this sort of thing was perhaps my first day of MS General Surgery residency, where I realized the grind was not just everything that was needed for surgery. There's a lot of grind that could be taken out of it, and still I could learn more and do more. That's where the residency. Other thing, when I went to Trivandrum, when I went for my MCH, it was a completely different program. We used to start at 6 in the morning. The boss used to come for around at 6:30 in the morning, but then at 5 o'clock, other than the fellow who's on call, others were out. So Bhaskar was my colleague, and we used to go to absolutely a great chap, basketballer, and we used to go to Shanmugam Beach and sit there. So after residency, after day of work, you could sit on the beach, palm side, India Coffee House coffee. And as the sun set, you used to see fishing ships coming inside with their lanterns that time dangling around the sea. And it should be a beautiful sight. That's where I realized there's a lot more that you can see around it. And as Dr. D'Souza said, I'm focused on work, but more on quality than quantity. And it may pay you less if you do less work, but you never feel a bit lost or uncharted. There's enough work for all of us, and enough work to keep us fairly busy and fairly happy. I possibly have not done a lot of foreign trips because of my way of behavior, but then I look back and I've, Dr. Jayanti just got about traveling, and I love traveling, and I just saw last 9 years I've done 52 trips. I'm not counting conferences. Okay.
Yeah.
Out of which I've driven almost 8 or 10. I've covered Karnataka, Gujarat, most of MP and Upper Kerala and Rajasthan purely by driving around. And I love once in 3 months break. I just get out of it. I don't like it. I know it sometimes causes a problem for work, but then there are people who will take care of most of my work sometimes or other. The other thing Dr. D'Souza said about this, and yes, sharing time with family. I've been a part of every project, every submission, every school activity, craft program, event. And 3 months back, my elder daughter went to US for her graduation after 12th. And I was very happy because I realized that I have not missed out anything with her. And that's the good part that I learned. This is one profession where we can say, I don't want to work today, and nobody is going to really question you much. how many of us really take that option? How many of us have really told, "Aaj OPD band kar do, maine nahi aane wala hai." That's where I think all of us should and share work. Most of my spine work I'm taking care with the spine team. I don't really do much of that. Vascular has moved on to endovascular. I work with them. They will send more patients to me, which are mine. So the workload just keeps on going up, and we just need to know that health is our core asset. We need to preserve it. Work has to be ethical and practical, and things will fall in place. I suppose that's what it is. The example of this, as I said, 5th of this month, Feb, is there are 3 things that are going to happen. One is a pediatric neurosurgery conference in Indore, which is being hosted by my co-registrar from Trivandrum. There's an oration at my parent institute, at my alma mater. Both of them become compulsions for me. There is a little hard run at Jupiter, which becomes my obsession. So I sweetly ditched the other 2. I'm going to be here. That's the take home for me right now.
Can I add to what you were saying? This is a quote by none other than Charlie Chaplin. He said, "The bank balance that you have at the time of your death indicates unneeded, unnecessary, extra work that you have done." How true?
Absolutely. The more and more we realize, the happier we.
I think most of us, after a particular stage in life, you have a home, you have a car, you have fridge, you have microwave, you have this, you have foot camera. After that, money doesn't become, money is attractive till we are finding difficult to buy something. But now each one of us at the flick of a moment or at a thought, go and buy what you like. Then the money loses fun in earning. And that is what happens to most of us. It's no more fun to earn money because you have enough to do what you want at which moment you want.
That brings to a fundamental question I would like to ask Dr. Avinash, that what is the fundamental mindset of a medico which keeps him or her away from this thought process? It's almost like anti-life thought process they develop. So what is
So I think what happens is that in medical school, at an MBBS level, when ethics is taught, we are taught that we are in a profession where we're supposed to be selfless and giving, and I always say it's good. I mean, there's no harm in doing that, but we can't pour from an empty cup. Okay, so the thing is, unless you yourself are fine, you can't pour your love and affection on anyone. So if you're not happy, I mean, you're not going to make others feel happy. So it's very important that we realize that self-care is far more important. It's nice to be selfless. It's beautiful to be selfless, but not at the cost of, your own self-care going down. So there are many times when even in practice, I get calls at 10 in the night or 11 in the night. Yes, I may talk to a patient 5 minutes, but I tell the patient, I can't have a session with you now because I'm not in the best frame of mind to talk to you. And I'm very frank with them. And I tell them, I've had a long day and I can't talk to you right now. It's not about the fees. I'm talking to you for 5 minutes. I'll see you tomorrow at this time. There are many times when I've had patients who've come into the clinic and said that we've gone to other doctors, but you're the first doctor who's given us 30, 40 minutes and listened to us. Otherwise we've been brushed away very fast. And I mean, not that there are doctors who do give time to their patients. I don't deny that. But, and they said, no, we have another patient, but you give us another day, another time. We want more time. We're absolutely fine. So even patients appreciate the fact that you give them quality time. That's, I think, which is very important. And once they know you're good and you give quality time, work comes. So we don't have to run after work. Yes, the initial few years, work always comes trickling in. And then once, the main thing is if you're connected with the masses, like I work with schools, I work with colleges, and you get known, work comes automatically. and it's not a big problem at all. But I think the most important mindset is that yes, we are giving, we are selfless, but then not at the cost of ourself, which I think is very, very important. And I always, I mean, I say this in a very sort of joking manner that there are times when uh, they ask me to see a patient post myocardial infarction or post cardiac surgery who's having depression, and and they'll very often tell me, sir, evaluate him, suggest whatever. So I mean, I'm on the heavier side. I go and patient asks me कि आपको heart problem नहीं? I said नहीं, मैं तो खुश रहता हूँ, कोई problem नहीं है. And then they'll say आपका cholesterol normal है? I said बिल्कुल normal है. And the patient is pretty thin and lean, and he has a heart problem, and he gets worried. I mean, I just tell them, I said the key motto is, in the end only three things matter in life: how much you lived, how much you loved, and how much you laughed. Nothing else matters.
Thanks. Thank you, Dr.
Beautifully
Avinash. That
said.
was very helpful. Yeah.
How much you live, how much you laugh, and
How much you laughed.
and how much you love. Yes. These are the only moments we are going to remember.
So Alpa, I'll ask again. I would like the panelists to opine on this one thing. I have this quote from Albert Einstein's collection. So if you want to live a happy life, tie it to a goal and not to people or things, they say. But there are many times when, in like Sir mentioned, loss of a loved one, loss of. So Dr. Avinash, Dr. Sir, EBTI Sir, is how is easy or difficult it is to find joy back and bounce back to what measures do you suggest? Sir said he linked himself to a goal and then got himself there. So how easy it is? And Dr. Avinash, do you find there is a difference to bounce back when you see men of means compare between ladies and the men? Do you find there is a difference bouncing back here?
Okay.
I think let's so give his comments, then I'll
Okay.
yeah.
Now, most important thing is realizing that you need to do something different. First, I must recognize that I am in difficulty. If I recognize that, I must earnestly feel that I must come out of that. That desire to get out of that is first most important thing. Second thing, it may be difficult for certain people, but it is never ever impossible for anybody. It's always possible for you to come down. Maybe you will take a couple of years to come out of that. But if you have people around you who have done that, they automatically inspire you. By God's grace, I had a lot of mentors, a lot of role models around me, starting from my school teachers to some relatives to some of my patients who molded my life, made me think otherwise. And I think one must be on lookout. You must have that attitude to look at people and absorb good. But then it's not difficult at all. It's possible to come out of that. And there always will be stresses. You will never be free from stresses. And there will be fluctuating stresses. But you must know how to get out of that. And you will, over a period of time, you will learn how to get out of that. Or you will also learn how not to go deep into the stress. It's possible. And without taking help of smoking, alcohol, or extreme solitude, or extreme spiritualism, or extreme harsh punishment to yourself. Without doing all that, it's possible to try to be creative, try to be good. Group activities will help you. Like he said, you must go and meet the friends. You must have party with them. You must meet your non-medical people. And I do that often. I enjoy them. We have a lot of get-togethers with this Zoom facility. A lot of my schoolmates, we come on the line, and in today's lingo, we have bunkas.
Weekend conferences, as Harshad would say.
we enjoy that. But it's possible, and I think everybody must that. There is a life beyond medicine. Please Raise your toes, raise your heels, make yourself tall, look beyond the compound or the wall that you have created yourself, and you will find a beautiful world outside. Start jumping, learn jumping. In a few days' time, you'll be able to cross over that wall and you will go into that beautiful world outside. But make a nice, beautiful door so you can come back. Or you can have an open door anytime you walk into medicine, anytime you go out, and let that be your daily affair. At 11:39 in the night, I'll sit on my keyboard and compose music.
Thank you, sir. Yes, Dr. Avinash, you would like to add something?
Well, I think, the biggest lesson in grief that I got was during the COVID pandemic, where I had a lady that came into my clinic. This was around the time of the second wave when we were fairly aware of COVID and we'd restarted clinic and practice. And she was a 44-year-old lady who lost her entire family to COVID. So she had 2 young daughters and a husband who both succumbed to COVID. She also had COVID, but she survived. So she came to me and, in such a situation, it's very difficult. What do I tell her? I can't even tell her, don't worry, things are going to be fine. And, it's, when someone has lost the entire family. And so I told her, what can I do for you? So she said that, I have only come here to listen to you and for you to give me hope, So I said, okay, I will try. I said, so I listened to her and I told her, talk about everyone, who went away and what. And she said that, it's the first time I've been able to openly shed my emotions and talk about things. And the session went on for an hour and a half because she was, going on telling me about everything. And then she said, so I told, and she said, I think, what is left for me to live. But then she said that, I think there must be others like me. So she went and formed a support group for people who lost their entire families in COVID, and they formed a support group of around 22 people who, and she in fact called me to address all 22 of them on an online platform. And these were 22 special people who lost their entire families. They were the only survivors, and they are now a unit. They work together, they meet, they party, they, do everything. So because they've been through that collective trauma together. So you can always build hope, at any point of time.
Yeah, so like somebody in the chat box also mentioning the art of giving and sharing. So that also brings joy.
Yes, no doubt.
That's beautiful. Yeah, that's a lovely thought. Alpa, we have anything or now I'll ask you, because Alpa herself is a teacher for yoga and meditation, and she has done her courses. And like we are talking about the stress of work, and there are sometimes we do or practice all our hobbies. We try to practice music, everything. But then there is something still which is there, which needs that peace of mind or the spiritual or the little alag se kuch karna hai. So Alpa brings that hope. So Alpa, can you just elaborate on that, how to go about and how much time you would say we should be able to
Alpa, unmute yourself first.
It's so very beautifully shared by all the speakers. It's just that of life has to be experienced. The joy of being has to be experienced. But it's like, everybody, it may not be possible to cultivate a hobby, or sometimes even after having a hobby or after having, having the passion also, you are faced with some difficult situation in life. There are some personal loss or some professional difficulties or many challenges, or sometimes, just your physical ill health. And meditation is something which I have found that irrespective of where you are or what situation you are, it's just that one corner of yourself you can get connected to, and without doing any activity, not be a hobby or a work or anything beyond, without doing any activity, you can just connect to that silent space within. And it's nothing like, as commonly believed that you need to be detached or you need to renounce and you need to be going away. It's just about being very alive and aware about what's happening to yourself. So being aware about your body, your physical needs, being aware about the calling of your heart, your thoughts, your emotions, and that is what helps you to become a very more complete person. And this is what I have found in my life and to my patient. And I mean, I was so fortunate that it got beautifully aligned with my profession. Like Dr. D'Souza shared that he started working with normal people and in preventive. So I discovered this side of preventive health. And so many of my patients who had lost hope because of their health or losing some loved one, they started connecting with me and learning meditation, and the kind of transformation I have seen in them and the joy I have got by them through this journey is just wonderful. And unlike people say that it's very difficult to learn meditation, no, like any other skill that you learn, like driving or painting, like any other skill, you can learn this meditation and anywhere. You don't need anyone else to be just with you and have the joy of being.
Thank you so much, Alpa, sharing this. And I think, Gauri, we should thank you all of you for being with us and sharing. And I would like to call your... Yes, sir?
Can I say something?
Yes, sir.
I have been watching the participant number. For a topic like this, so many people attending it indicates that the topic is important in people's life. Number one, it is an important topic in people's life. And people have become aware that something needs to be listened to about it. Something must be heard. We must hear out what people are saying. What are people saying? What are the ways, etc. So I think probably maybe few people, handful of people have come here who have nothing to do with burnout, nothing to do with facing stress. But most of us are in this particular meeting now because it has bothered us some time or other, in some manner or other, to some extent or measure. So it is an important. And let's hope that this seminar or this particular talk or such things in future become more awareness. I think anything can be remedied or anything can be addressed only when you become aware of it. If people don't have become aware of it, oh, उसमें क्या है? उसमें ऐसा कुछ नहीं होता है. वो सब बंडलबाजी. If people think like this, probably they will deprive themselves of getting out of those difficulties. So I
therapeutic
think
sessions,
meetings are
discussing.
important.
And I think that's the most important message to, no matter what may be your age, if you are young and you realize this, it's even better. But even if you are on the verge of your retirement, doesn't matter. It's never too late to start. And Dr. VTI sir is the best example for us. And for youngsters, Dr. Harshad and Dr. Vinash. So I think this is the most important thing, and which is not taught in our medical schools. It is not taught by our seniors because they have been, trained otherwise. And I think it's time to change. It's time that we take our life into our own hand, live and laugh, and, the joy of being. And that's what is very important.
Thank you, Dr. Avinash.
Thank you so much.
Yes, and thank you so much, all three of you, for sharing your time and your insights.
Thank you, Gauri.
Thank you, all the participants.
Jayanti.
Thanks, everybody. Thank you.
Thank you, everybody. Bye.
Bye-bye.
Good night.
Bye. Right.
There were no chat questions. I did not see.
There are no questions, but there are comments.
Comments, yeah.
Yeah, no questions.
Mast झालं, sir.
Thank you. Thanks a lot.
Even many things
Thank
we
you,
are not aware of.
Beautiful.
Yeah.
Very nice, sir. Very nice. Harshad, you are also too good. खूप
Yes.
छान झाला
Akash
कार्यक्रम.
left. Yeah,
Very
very
nice.
nice.
Very nice.
I will need to take sessions from Harshad. Though I keep on breaking his head in the doctor's lounge, asking him
Harshad,
tips.
Harshad is like a child and so full of enthusiasm.
He's so cute, huh? He's so cute.
Pinky,
Yes, sir.
because you keep eating his head, he's enthused to do this. So you should be thanked for it.
So for me, one of the stress buster is doctor's lounge.
Yeah, that's absolutely.
That's why I go there daily
Absolutely.
without Naga.
Absolutely.
सर तुम्ही पेटीचे क्लास सुरू करा.
मी शिकवायला तयार आहे, तुम्ही यायला पाहिजे.
येऊ सर. आजच्या सेशन नंतर सगळे इन्स्पायर झाले.
100%.
मी गायला शिकवत होतो तेव्हा तुमच्यातले हार्डली एनीबडी केम देयर.
चार्ज.
हाँ?
आज गौरी वुमेन सर्जन्स ग्रुप से काफी लोगों ने
अटेंड
किया.
ओके, लेट्स डू दैट.
अच्छा, वाव.
हाँ.
मिले ना क्रिकेटर्स.
There are many from our class. I think they have been sir student. माझ्या वर्गातली खूप मुलं जॉईन झाली ती. संदीप पटवर्धन वगैरे
सायन्सचे होते बरेच लोक.
सायन्सचे खूप लोक होते.
सायन्सचे. सर
चला बाय, गुड नाइट. डिनर टाइम नाउ, सबको टाइम पे करने का है, अभी खाना खाने का रेडी है.
Just comment. Very good comments. Very inspiring. And great session, full of positivity.
Yeah.
Thanks.
चांगलं झालं.
Superb session. Okay, great. Sir,
Thank you.
tension ही नहीं था.
हाँ, sir. शुरू किया.
I think his first 15-20 minutes were actually like आपण म्हणतो ना म्हणजे प्लेनरी ह्याला कशी असतात, ओरेशन्स कशी असतात. It was almost like that.
अरे ओरेशन कसला. I just honestly spoke what I went through.
Yes.
सर एक नॅरेशनला पण इम्पॅक्ट असतो. There are a lot of people who experience, but only those make an impact who actually live through that. We all could get that.
Yes.
Yeah, that was absolutely
straight from the heart.
Yeah, and it was so impactful. मी म्हटलं ना तुम्हाला, आता मला खरंच पेटी शिकावी असं वाटायला लागलं.
शिकवीन तुला.
Honestly, I'm not joking.
I will honestly शिकवीन तुला मी.
चालेल. Okay. चालेल. Okay. Alpa, you did a wonderful job. You are so calm na when you are talking to people, honestly. Absolutely. Nice. Very nice. Even Dr. Avinash was also very good. He's
yes. His concepts were very clear. Very absolutely clear what he was talking.
He looked like a very cool and relaxed person from within, you know.
Is he there? Is he still around or he's not?
No, he's left. He and Harshad have left.
I think
we'll convey to him.
Only 20 people are there now.
We will convey.
Okay.
People are still joining.
Yeah, okay.
The link is on. The people are still joining. Let's close.
Okay.
So you want to have fun session now?
Good night. Thank you so much.
Sir, time to sleep now, sir.
Time to sleep. That's right.
Time to sleep.
Thank you, sir.
Sir को देख के लगता है
thank you, sir.
ना इंटेंसिटी ना जो करते हैं उसमें इंटेंसिटी डाल दे.
Upon that is my congenital defect.
हाँ?
That is my congenital defect.
Sir, तसं नाही sir. Just to add, you and Menon madam, no, you don't even look 75. So that is such an
75 का
inspiration.
sir, 78 now.
79 running.
माहितीये मला. माहितीये. So thing is, so sometimes you feel की अरे किती वर्ष प्रॅक्टिस करणार, आता हेच करणार का आपण. So immediately it comes, अरे sir आहेत यार. He's doing so many things. So madam is still coming to the hospital. It's not so difficult.
Actually, मला थोडा वेळ आणखी नसता तर तो एक पॉइंट मी घेणार होतो की when you stop enjoying medical practice, you want to retire, you get stressed, etc. At my age, and there are many people like me who, unlike in United States and other countries, we would like to continue to work because we enjoy medicine.
Yeah. Yes.
See, at the end of my busy day, say morning surgery and OPD, which is ending at 8 o'clock, critical, complicated neurological patient आला तरी माझ्या कपाळाला कधी आठ्या असणार नाहीत. Because we enjoy that. And I wanted to, if there was a time, I would have said how to enjoy your present medical life that you're pursuing. If you don't enjoy that, you will get bored, you will get stressed. मग तुझ्या डोक्यात विचार येणार हा.
So I think that is a sign that you need a break.
Yeah, that's a sign to that. But it's the break, huh? It's a comma or
of course.
Semicolon. That's all.
Yes.
Not a full stop.
No,
or
not
period.
at all. Yes.
हे बघ, जोपर्यंत देवाने तुला काहीतरी ठरवून पाठवलं असेल, तुला उगीच डॉक्टर झालीस का तू?
नाही सर, घाबरू नका, मी मध्येपर्यंत प्रॅक्टिस करणार आहे.
त्याच्यामुळे तू करत राहायचं.
पेशंटला आवडो किंवा न आवडो.
Whatever you enjoy, you should.
माझे कॉन्टेम्पररी जे आहेत आणि माझे सिनियर्स, when we meet and discuss, we always say की we are passionate about working with the people, interacting with the people. आणि हा जो फील आहे that even at this age we are useful to somebody, कोणाच तरी उपयोगी पडतोय, हा खूप मोठा फील आहे. तो इम्पॉर्टंट फील आहे या एजला.
येस ट्रू.
तो राहायला पाहिजे.
Yes, sir.
Unless you become so dangerous that you are cutting vena cava while operating spine from behind, or you're harming people, or becoming aggressive and abrasive. पेशंटने औषध नाही घेतलं, त्याला आई बापावरनं शिव्या घालणार असेल तर मग तुम्ही प्रॅक्टिस बंद करायची.
ट्रू.
चलो, ओके,
चलो.
Thank you, girls. Thank you, boys. मजा आली.
Okay, bye. Good night.
I enjoyed sitting here and talking to you.
Thank you, sir. Thank you so much. Okay, bye, Alpa. Bye, Gauri. Bye, everyone.